Hi, and welcome to Fairview Range Focus. I'm David Hall. Today we're joined by Jamie Perell, who is the Manager of Emergency Services, and Meghan Rossini, who is a Patient Care Supervisor for Emergency Services at Fairview. And today we're going to talk about emergency services and urgent care.
Yes, thank you, David.
All right. Well, welcome. Glad to have you both here.
Thank you.
So let's start and talk about the difference between emergency room and urgent care. And then we often hear about those terms used together and kind of in the same area too. So help us understand that.
Yeah, absolutely. So even though it's in the same area in the hospital, we're two different areas as such. So as a patient comes into the hospital and they have an urgent matter that they need to be addressed, they're going to stop at the registration desk and they're going to get some simple details, what brings you in today. From there, they're going to contact our triage nurse who actually comes from the emergency department, and they're going to do a quick, rapid, focused assessment on the patient just to determine how severe their illness is likely to be that day. So really the difference between the emergency department and urgent care is our sicker patients are going to go to the emergency department, and patients that, have conditions that would likely be able to be seen in a clinic setting, those ones would get sent to our urgent care center.
Okay. So it sounds like it's kind of a way to prioritize who needs to be seen and maybe what order, is that?
Yeah, absolutely. So in the emergency department, it's always going to be based on the severity of illness. So let's take an example of if we have a patient with a chest pain exhibiting signs and symptoms of perhaps they're having a heart attack, and then you have another patient come in who maybe has ear pain. So that's likely something that could be seen in the clinic. So what's going to happen is those patients with those more high-risk clinical conditions are going to be seen first, and the patients with the more minor conditions would be continuously pushed to the back of the line. So that's where our urgent care center really comes in. The patients over there are seen on a first come, first served basis. So they're not consistently moving to the back of that line. They're being seen on the basis where they come in. So it's definitely a good way where we can move our patients through quicker who don't have necessarily the severe condition.
Okay. So how does that correlate to wait times? From the standpoint of when someone's been triaged and maybe I come in and I have an earache and so I'm going to be waiting in the waiting room. Does that affect my wait times or how soon it is before I get in? Or?
Yeah, absolutely. We call it throughput in the hospital setting. It's something we pay a lot of attention to. So in terms of wait time, on average, we can get an emergency department patient who's discharged in and out of the department in 131 minutes. And those tend to be your more simple cases where you don't utilize a whole lot of resources that go into them. For the urgent care, we average about 50 minutes getting our patients through there, and we set goals for these patients too on how fast we want them to move through the system. So I would say the biggest beneficiaries for the wait times are, in fact, our urgent care patients, just because we can see them in a more streamlined fashion through our urgent care center.
Okay. So as I understand, the layout of the department is that there's two physical different areas. I mean, that if I come in for urgent care, I'm going to go to a different area than if I come in and after triage go to the emergency department. Is that right?
Yeah, that is true. So, relatively speaking, the urgent care and emergency department, they're in very close proximity to one another.
Okay.
The emergency department, when you enter there, there's going to be a lot more equipment, monitors, resources available within the department, whereas if you went into the urgent care space, it's going to be set up more like a clinic exam room.
Okay.
So.
Okay. All right. I've heard this question before. Somebody comes in and they go through triage and they're asked to sit in the waiting room. And they look around and there's no one else there, but yet they may have to wait for quite a while before they are brought in. Does that happen? Could you help us understand?
Yeah.
How does that happen?
Yeah, absolutely.
It's actually a really great question and
Okay.
one that the nursing staff gets asked a lot. So what patients don't see a lot of the time is that the emergency department specifically, we have patients who come to us via ambulance, and they come in a completely different entrance than most people. So a lot of that isn't seen up front. And as far as like if you were waiting for urgent care, sometimes what happens is we have patients who kind of come in all at the same time. So while nobody's out there waiting, they may all be occupying rooms.
Okay. So again, looking at how work is prioritized or the care, people brought in ambulances might be more serious and require attention and resources. So versus, again, I'm sitting in the lobby waiting because I have an earache or a small cut or something, may have to wait for other people to be taken care of. They're a higher priority.
Yeah, that's correct.
Okay.
And one thing we're always doing in the department as well, we're monitoring the EMS channels. So we kind of always know what's going on in the community. So we may know that they're dispatched to a car accident or dispatched to somebody with chest pain. So we're just always trying to look for what might be coming in the door too. So when operations are completely normal, normally we do not hold beds. We do try to fill them all. But if we know something's happening out there in the community, we try to be proactive and, okay, this person could be coming in with a more serious medical condition, so we just need to hold off and wait and see how that plays out.
That's a great point, Jamie. I mean, I think that's probably something the general public isn't aware of, the fact that you are monitoring EMS channels and knowing what's going on. So it isn't just an ambulance shows up at the door unexpectedly, and so you're anticipating that. So that's a great point. I'm glad you brought that up. We're talking about wait times, and I think that's always something that can be frustrating for any of us, waiting for a service, whether it be an emergency department or somewhere else. Sometimes the emergency room can take longer than urgent care or something. Can you help us understand what exactly is behind it? Why does it sometimes take such a long time for someone to go through the emergency department?
Oh,
Yeah, it's really patient dependent in terms of wait times and whatnot. So a patient who's seen in the urgent care will go back to the patient having ear pain again. So that patient's not really going to require a whole lot of resources past the practitioner going in the room and grabbing an otoscope, looking in their ear. Whereas, say we have a patient who comes in, they have abdominal pain, and that might be a little bit more of a workup. So we're going to have to order lab tests. We're going to have to draw the blood in addition to waiting for the analyzers in the laboratory to process those results. And then if you factor in things to, for example, with the patient with abdominal pain, they'll frequently get a CT with oral and IV contrast. So with that oral contrast, the patient drinks that over 2 hours and then has the test completed. And from there, we actually send it to a radiologist to be read, so it takes time for that interpretation as well. So if you come into the emergency department with abdominal pain, it's normal that it could be about a 4 to 5 hour length of stay for you.
And that's probably not taking into consideration if there's other more critical patients that come in that cause delays. And
absolutely,
yeah.
the resources generally get allocated to the most sick patient, and sometimes that can be most definitely difficult because nobody's having a good day if they come into the emergency department. We understand that. So we sometimes say, in essence, even though it doesn't feel like this, but it's almost thankful that you don't have all the clinicians right there, because usually that's the sickest patient where those resources are allocated.
Right. Well, I guess that's one of the beauties of urgent care system, in the sense that with that now, not everybody isn't waiting for the emergency department or emergency room because there's different resources or different rooms. So that's probably one of the benefits. It does reduce some of that wait time, I'm sure. So help us understand a little bit about as far as what types of patients or symptoms might be seen in the urgent care.
So patients with symptoms of, like, say, a sore throat, a cough, little kids with fevers, ear pain, small cuts, or say you tripped and you spun your knee, or maybe you think you sprained your ankle. Those are things that we would typically send over to our urgent care to be evaluated over there. Jamie's talked a lot about resources, and we try to keep it that you're going to use minimal resources if you go to the urgent care.
Okay.
And there are times too where if a patient goes to the urgent care, so as we go through the triage process, we do a quick assessment on the patient. So as a practitioner goes in the room and examines the patient, they might determine that more resources are really needed than can be provided in the urgent care department. And if that were to occur, we would transfer the patient to the ER, and they would be seen over in that department.
Okay. Good to know. There are urgent care providers, and then there's emergency department providers. I know often we have advanced practice providers in the urgent care. Do they consult with the physicians on the emergency department side as well, if needed, or?
Yeah, that actually happens on a frequent basis. So say a patient comes in and maybe they're getting thrown a little curveball, but we think we can deal with it in the urgent care. They just might go bounce some ideas off the emergency department physician who's actually in charge of the whole area there. They're
Okay.
responsible for the care rendered in both areas. So we just kind of bounce ideas off of each other and kind of determine what the appropriate next steps are.
Okay. Well, that's a great resource.
Absolutely.
So if I were coming into emergency department urgent care and I didn't really know where I should be seen, does that matter? I mean, do I need to know before I come in what kind of, whether I'm going to go to emergency department or urgent care? Does it matter?
Patients don't need to know where they're going to be or where they should go, because the ERRN will actually be the one who will kind of take some information, like Jamie said, perform a quick assessment, and kind of based on that patient's history, their medical problems, the kind of meds they take, the nurse will kind of make the decision as to which area can best serve that patient.
Okay, great. So again, a patient doesn't have to worry about that part of it. That's decided for them once they come in.
Correct,
Okay.
yeah.
And that's the initial triage that you were talking about earlier, I think.
Yep,
Yes.
that's
Okay.
correct.
All right. How about the hours of urgent care? What are the exact hours that it operates?
Sure. So our urgent care is open every single day, weekends, holidays. It opens at 9 o'clock in the morning, and we'll take our last patient at 10 o'clock at night. So we're open 13 hours a day.
Okay. And does the emergency department have hours?
Open
No.
24 hours a
Okay.
day. Doors always open, lights on.
Okay. So if the urgent care closes, then it's not, if somebody comes in with something simple, it's not that they're not going to be seen.
Correct. Every patient will be seen.
Okay. So if urgent care has been closed, they're going to be seen over on the emergency department side. Is
Yep,
there?
that's
Okay.
correct.
All right. Very good. So we've just touched on briefly the advanced practice providers. So what is that? Help us understand what exactly or who that is.
That's a really good question, because a lot of people, you
Frequently
just
asked.
ask, well, what's an advanced practice provider? Advanced practice providers are your nurse practitioners or your physician assistants. And those are people who have often been a nurse or worked in the healthcare field prior to going back to school, and they'll go back to school for like a graduate level master's or doctoral education, specifically trained to be a provider who's got more knowledge than a registered nurse, but kind of works in conjunction with a physician.
Okay. And as you said, Jamie, they're working somewhat in conjunction with the physician over on the emergency department side, as far as the standpoint if they need to consult with them or if they have questions or something about the care.
Yep, and we actually, so there's always a physician in the emergency department, so we
Okay.
always have a medical doctor there.
Okay.
We also staff advanced practice providers in the emergency department as well to supplement the physician. It just, so we can see patients a little bit faster over there as well. So the physician, they're gonna see the sickest patients in the emergency department. So maybe somebody's having a heart attack, a stroke, it might be a bad trauma patient, and like our abdominal pains or simpler ER patients that maybe require more resources, those who our advanced practice providers would see over there.
Okay, great. Trauma centers. I know we are one. Fairview Range is considered a trauma center. There's different levels. That's the part we need your help with. Help us understand whether there's different, how many levels are they and what level are we? Maybe you can explain that.
Well, Fairview Range Medical Center, we're a level 3 trauma center.
Okay.
There's actually a level 4, I believe.
It's a 4-level system throughout
Yep,
the
four
state.
le- four
Minnesota
levels.
has the
Yep.
4-level system.
Okay.
Someplace like Hennepin County Medical Center, they're considered a level 1 facility.
Okay.
They just have
That's
mo-
the highest level
yes,
it could be.
Yes. So they have more specialists, more resources available. They also do research, and it's the availability of those specialists and the research that classifies them as a level 1. Now, a level 2 center, those are what we have available to us down in Duluth. Both St. Luke's and St. Mary's are level 2 centers, and they have more specialties, say like interventional radiology or a neurosurgeon or the cardiothoracic surgeon. They have more specialties available, and that's why they're classified as a level 2. We're classified as a level 3 because we have 24/7 emergency department coverage by a physician. We also have 24/7 coverage by an on-call surgeon, and we have 24/7 capabilities to have a CT scanner and those images read.
Okay.
You know, and some of the benefits being a trauma center as well, there's some states that do not have formalized systems for this, and what research has really shown with states that have these established systems in place, mortality and outcomes do improve. So we actually have a registered nurse in the emergency department, and her sole purpose is evaluating trauma. So every single patient, whether it's a terrible motor vehicle crash or if you simply stub your toe, she's going to go through and evaluate every single one of those records and determine, was care appropriate, and furthermore, you know, care might have been appropriate, but were there opportunities where maybe we could have done something just a little bit better? Maybe we could have moved the patient through the system a little bit faster. Could we have cut down on our time to get to imaging? Just looking for all those opportunities. And Fairview as a whole, there's just a very large trauma system. So all the hospitals, they meet together. We actually do shared learning through case reviews, lessons learned. There's a system trauma medical director who comes up and collaborates with us, and we're always just getting education, whether it be for pediatrics, geriatrics. Hematology was an interesting one for blood administration, because that's something always in the front of your mind when there might be a trauma patient.
Okay.
So we also have a trauma medical director here as well, who's our chief of surgery, who does a secondary review of every trauma patient that comes through the system.
Wow, sounds very involved.
It is very involved.
So, I mean, as a level 3 trauma center, do you go through certification or a review, or how does?
Yes, actually we do. We are certified by the state of Minnesota. They designate us, and whether we're meeting the certain goals that the state has set forth, whether we can stay designated as a level 3 facility. And part of being designated is that the physicians and the nurses all have to have special training for trauma care.
Okay. Now, and is that a certification that is good for the whole time, or for years, or is it renewed every so often? Or?
Yep, it is renewed every 3 years.
Okay.
So the Minnesota Department of Health, they'll come do a comprehensive evaluation of our facility, and we were actually just reevaluated in May, and we're expected to maintain our level 3 trauma designation. So they're going to go through, make sure we're doing what we're supposed to be doing in terms of reviewing all the trauma cases. That's something that they want to see. They tour the facilities, see blood products that are available. They want to meet with medical staff, and what they do is really identify any opportunities for us to improve as well. And if we can demonstrate clearly that we're doing that, you're usually in good shape.
That's great. Well, it sounds like being a level 3 trauma center is really something to be proud of, and a great resource for the community.
It really is.
Good, good. Well, we're going to take a break real quick, and we've been talking about the department, urgent care and emergency department, and we're going to show a little video clip here of the tour of the facility, and so watch and see what you think.
Welcome to the Fairview Range Emergency Department. This is where you would come into the emergency department or the urgent care, and your first stop would be here at registration to give them some information. And once you give them your information, she would ring the triage nurse for us. And then we would head over here to the triage door. And this is where our patients would come, and then they're greeted by the triage nurse. Today our triage nurse is Jason.
Oh.
And this is where everybody comes and starts their visit. They all start with the triage nurse, sit down, the triage nurse gets some basic information, takes your vital signs, and does a quick focused assessment, and then determines whether you need to be seen in the emergency department or the urgent care. And next we'll be going into the emergency department. And this is where our visit starts for people coming to the emergency department. You are brought back to one of our 11 rooms. We have 2 critical care rooms, which we'll start and show you what a critical care room looks like, and then we'll show you what one of our other rooms looks like, if you'll follow me. This is one of our critical care rooms. As you can see, we have a lot of extra equipment in here to take care of a patient who is going to need a lot of resuscitative efforts. We have our monitors, which we monitor the patient from here, and it's also visualized over there. And then we have just different things that we're going to need to take care of a patient who may be experiencing a respiratory or cardiac emergency. And now we're moving into one of our regular rooms. All of our rooms are actually equipped to provide a resuscitation to a patient. As you can see, this room isn't quite as large as our other room. Our other room is more geared for a team resuscitation. This room is where most patients will come, and we still have all the monitors and stuff here. So after your brief visit and triage, if it's determined that you're going to be going to the urgent care, you would come back to registration, give them some more information, and then you may end up going to the waiting room. Or if the urgent care is ready for you, you'll go back into the urgent care. Let's go see one of our urgent care rooms. And this is one of our standard urgent care rooms. This is where you would come if you were triaged over to the urgent care with like a sore throat or an earache. And as you can see, it's set up mostly like a clinic exam room. Just kind of basic stuff to check your eyes and your ears.
Okay, great. Well, that's I hope you enjoyed seeing a little bit more about the department, actually seeing inside the department. It's a beautiful facility. Have a lot of resources. I think you have a lot to be proud of, no doubt. And I think our community is no doubt better off because of the great services we have within our emergency department. So thanks for that tour. But now let's go on to another question. Let's talk about acute stroke ready hospitals. Exactly. Jamie, tell us, what does that mean?
So this is another designation that you can get through the state of Minnesota. So in 2015, the Minnesota Department of Health designated us as a stroke-ready hospital. So part of that is much like our trauma program. We have standard protocols and procedures for patients who come in who have a positive FAST exam is what we call it. And some of the things we're really looking at for that is, say the patient comes in by ambulance and the physician is going to do a quick eyeball assessment on the patient, and we're going to have that patient to our CT scanner within 10 minutes to run a head CT on them. So we can determine if it's an ischemic, which is a clot in the brain, or a hemorrhagic stroke, which is a bleed, because those are two things we would treat very differently.
Okay.
And we have standard benchmarks for how fast we need to get those images resulted and how fast we would treat that.
Wow, that's interesting. So there's a real defined process for somebody coming in and exhibiting some symptoms that might be stroke related, of how they're treated and the course of action, everything. So
yep, absolutely. Okay. And as with the trauma program, we're reviewing every patient that comes in who exhibits some signs of neurological symptoms or deficits that we identify, just to determine if the best care possible is provided to that patient.
Okay. Good. We've talked a lot about the department and hit a lot of different services. Is there anything else you'd like to add about the programs or the services you offer within the emergency department?
We also have on staff 9 sexual assault nurse examiners through Fairview Range Medical Center. So there's grants throughout the state, and we're able to put these nurses through training just so they can better assist a patient who may have experienced a sexual assault. And they really specialize in evidence collection and preserving that evidence, and really being an advocate for that patient and making sure that they can proceed in the fashion best for them.
Okay. And that's a very specialized training that the nurse receives in order to
yes, it's a 40-hour training.
Okay.
In addition to that's the lecture portion, and they actually work besides our family practice physicians and receive training for them as well. There's really a lot that goes into that.
Good. Well, it's probably one of those resources that isn't used a lot, fortunately, but very important when it is used. No
yeah,
doubt.
Thankfully it's something we don't have to use
Right.
very often,
Right.
but you know, for the few cases a year, you can really make all the difference.
Okay.
So.
Well, we're about out of time. Thank you both for visiting with me today, and more importantly, for sharing with our community and the patients and public that we serve about the great Department of Emergency Services and urgent care that we have to offer. I know it's depended upon by lots of people, and a great benefit to the organization and the community. So thank you both for joining me today. And more importantly, thank you for joining and for watching. I hope that you found it interesting, and I hope you'll watch next month for another segment of Fairview Range Focus.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.